Hi, I'm Ashley Speliotis, the Director of the Somerville Council on Aging. Welcome to Senior Circuit. Today we have with us Courtney Johnson from Somerville Cambridge Elder Services, who's kindly joined us to talk about mental health services, some different mental health diagnosis that you see a lot in our community, and also to talk about your organization, Somerville Cambridge Elder Services. So why don't you share a little bit about yourself?
Hi, my name is Courtney Johnson. I'm the Clinical Integration Manager at Somerville Cambridge Elder Services. Somerville Cambridge Elder Services is an aging service access point in Somerville and Cambridge. So we provide home care services, Meals on Wheels, aging and referrals. We have a mental health program, and we operate in Somerville on Medford Street next to the Target, if you're interested in walking in. I've been with the agency now for over 6 years. I started as an intern in this program, the MHOP program, the Elder Mental Health Outreach Program, and I've been there for 6 years, and now I'm the manager of that program. I also supervise the Family Caregiver Support Program.
Great, yeah. Somerville Council on Aging and Somerville Cambridge Elder Services are a true partner in serving our seniors, and I always like to say that the Council on Aging helps to get people out of their house and to come into the center, and Elder Services provides a lot of in-home care. So some of like the home health aides and some different programs like assistance with shopping. Programs to help make you safe at home.
Laundry.
But, yeah, exactly. But your program is specifically for mental health services.
Yes, so
right?
The Elder Mental Health Outreach Team, what we do is we provide in-home therapy, clinical case management, medical coordination, and resources. So part of our work is we work with clients in their homes providing therapy. So it could be talk therapy, counseling. Sometimes we do like guided imagery, meditation. And what we also do is we help clients who are maybe in a clinical case management setting, would be like if someone has an eviction and they need help kind of navigating that system and kind of connecting to resources there. So we are very connected in the Somerville and Cambridge area to kind of support people.
And try to see if they have services that match their needs. And the MHOP program is a relatively new program, would you say?
Yeah, we started the pilot in 2018 after seeing a need in the area. We used to have a very small in-home therapy program, and then we applied for a grant and we were able to expand it. That's how I got hired. And we've noticed that it's been very helpful. A lot of times we get referrals from clients directly, but we also get referrals from protective services, we get referrals from hospitals, people's doctors, and we can kind of be a very flexible bridge program to long-term supports.
Yeah, I know you mentioned you're in-home. You provide most of your services in-home, which is kind of a niche service for you, would you say? That there's not so many resources to have it
we
in-home.
noticed that there's a lot of like behavioral health support out there, but it's not accessible to everybody. And so we provide in-home therapy because it allows people access who probably couldn't get to a doctor's office or couldn't get to a behavioral health partner. And so we kind of go there and kind of work with somebody, and I've actually have facilitated like virtual visits with their doctor on my laptop to kind of like help bridge that support.
Absolutely, because sometimes people need help to access services, and whether it's their physical health or transportation, all can pose different barriers.
Oh, totally. It's been very eye-opening to kind of see like what is not available to people, and so that's why we kind of started this program. And the Elder Mental Health Outreach Team, we were one of the pilots, and it has been growing throughout Massachusetts. So a lot of different, like there's 18 or 19 sites right now throughout Massachusetts. So
18 or 19 is definitely a feat out of 351 communities. It's a unique and really great program for our residents of Somerville to have access to, because you're doing, like you said, kind of a combination of in-home therapy, some different case management, but sometimes mental health is a little bit intimidating
Totally.
to access their services, right? And I think a lot, you were telling me before, a lot of people that you see may have some degree of depression in there. Would you say that's maybe one of your most...
That and anxiety are like our top diagnoses that we see. And depression could kind of come up at a variety of times for people, like if they had a recent loss of a loved one, if they have a new health condition, things like that kind of come up. And so we've been seeing that a lot in our program.
Yeah, I think you just said it very well, that some people may attribute their depression to a certain situation or like a situational depression that's happening. And some people might describe it as like a funk they're in. But how would you say, like, what are some of the signs or symptoms of depression that you would say maybe it's more than just a funk?
Yeah, so I would say if someone is noticing maybe they're feeling a funk, but they're noticing a lack of interest in things they were doing in the past before, they're isolating more, they're maybe getting some aches and pains that they didn't have before, some stomach upsetness. The body and the mind are very connected, and so like one thing that's really difficult sometimes for older adults is getting the diagnosis of depression, because people who are older show depression a little bit differently than maybe younger people. Sometimes you might have more physical symptoms than maybe the persistent sadness, which is one of the symptoms of depression. Persistent sadness, feelings of hopelessness, feeling lost, feeling guilt over like past things that are like a long time ago happening, sleeping more or less, actually. Eating more or less.
Yeah.
These all kind of attribute to signs of depression.
Yeah, and you spend a lot of time working with people with depression, and what would be some of the risk factors, do you think?
Yeah, so if you have a history of depression, like if you were depressed when you were younger, that could be a risk factor as you age. Stress, so if you're a caregiver, if you're taking care of your husband or your wife who has like a diagnosis of dementia or something, that could lead to depression. If you have family history, if you have a new onset like health condition, sometimes health conditions can present like depression and it's not necessarily depression. So like I've seen people who have very low B12 and that is actually a low B12, but they show all the signs of sleeping more, eating more, very lethargic, those type of things. So
yeah, it sounds like maybe the first step is really thinking like, this isn't how I normally act.
Exactly.
Or these feelings are going on longer than, I don't know, what would you say, like a few days, a few weeks?
They say if you've been having symptoms, if you're noticing symptoms lasting more than 2 weeks, it might be good to kind of talk to your doctor to get like a workup done, medical blood work, just a physical kind of seeing. If they can't find a health condition that's maybe leading to the depression, then it might be good to kind of ask for a referral to get like a therapist or to do like an assessment.
Yeah, because 2 weeks is actually not that long when you think of it.
Yeah.
And do you think maybe some people kind of go on longer than the 2 weeks, would you say?
Yeah, I think what happens is people are just, well, I'm just tired because I have this medical condition, or I just want to sleep a little bit extra. There's nothing like, I don't have to wake up early. I don't have anything where to be. And so like that could kind of build up to feelings of depression. Like you're just kind of like losing your routines and things like that could be very jarring for people.
Right.
And so sometimes people don't notice that they're doing that until like, maybe they're crying in the shower or like something's happening and they're like, what's going on? I didn't notice any of these signs before.
Yeah, I know sometimes maybe they recognize it, or perhaps maybe their family members might recognize it, or caregivers or friends. And then what would you say would be some treatments?
Yeah, so there is traditional talk therapy. So they have like different modalities, CBT, cognitive behavioral therapy, interpersonal therapy, joining a group therapy so you can join other people who might be experiencing the same kind of things that you're experiencing. There are antidepressants. So based on like my understanding, a lot of older adults are prescribed SSRI, which is a serotonin reuptake inhibitor. Always forget that. And so those are like traditional ways. Some people, most depression is treatable, but some people don't necessarily react to like the talk therapy or the medication. So there are things like ECT and that type of long-term, but they're also a holistic, because I've heard from people that like, I don't want to take any more medication.
Sure.
How many more medications do I have to be on?
Yeah.
And there are holistic treatments. You could join a walking group. You can just get more involved with your community. There are making sure you get more sleep. So that could be maybe having better bedtime habits, kind of getting that more sleep, eating more like healthy foods, music therapy. There's meditation. The Cambridge Health Alliance has a program where they have like a meditation group that you can kind of join. There's like, what would be another thing? You could join the senior center and go and get some connections. We have a lunch we do with you guys.
Absolutely,
as well.
absolutely. It sounds though that there's kind of different treatments for different people.
Totally.
And that it doesn't really, maybe even going back a little bit in the conversation, that it doesn't appear that depression or any type of mental illness really appears the same in every person that you see, and that maybe the treatment isn't the same for every person.
Yeah, I think it's always best to kind of, if you are feeling symptoms of depression, is to kind of work with a therapist to kind of see what treatment plan would be best for you, because some people don't necessarily want the structure of cognitive behavioral therapy. Maybe they just want to create some goals and kind of work on that and kind of create routines. Sometimes routines really help people who are feeling depressed, because they can get, like, getting out of your home is very important.
Sure. You mentioned cognitive behavioral therapy, and maybe some of our viewers aren't familiar. Could you describe that a little bit more?
Yeah, it's basically talking about how like your thoughts really impact your behavior, and so like working with a cognitive behavioral therapy is kind of working on changing the way you're thinking about things. Maybe you're perseverating over like a certain thing and you're looking at it a different way. Sometimes a therapist coming in and kind of saying, hey, like I'm noticing that you're saying this, but have you thought about it this way? And then they can kind of do like, they give you homework and you can kind of do worksheets and kind of learn like how you can kind of maybe think things a little bit differently.
Sure.
Yeah.
And change your thoughts in a certain position, and maybe help to change your reaction for it. So that's one therapy, cognitive behavioral therapy. And then you were mentioning like talk therapy.
Yeah, talk therapy. One of my colleagues used to do expressive arts therapy, and so they would do art together while they're talking about like maybe something that's triggering to someone, and kind of like drawing it in a picture and kind of getting that kind of work done. And sometimes that feels not as scary to do, because you're kind of like doing it in a way that's therapeutic with the art, but also expressive, so that you can kind of like put your words to a picture. Because sometimes I think with depression, people don't want to talk about it. There's like, I don't want to talk about it. I'm strong. I don't want to talk about these problems. And so they don't mention them. And so then that kind of festers a little bit, and then it's a bigger problem then.
Exactly. So there, it seems like there's just a whole different modalities of doing it individually, doing it in a group. And how would you describe a group setting for people?
Yeah, so usually groups, we're hoping to start groups soon, so I'm going to put a little plug in there, hopefully. So usually a group would be anywhere from like maybe 6 to 10 people. People will sit in a circle and kind of share what they're kind of going through. And there's a therapist there who would kind of moderate the group. They would join in, ask some questions, but it's mostly a group dynamic where everybody kind of gives each other feedback and said, okay, I'm feeling depressed because my spouse was diagnosed with cancer, and I'm feeling like very lethargic and all these different things. I'm feeling very stressed. And then another person in the group might have that similar experience. Maybe they took care of their parents. Maybe they're going through a similar kind of reaction or thing going on, and people will kind of like bond in that way. And so the group kind of works together to kind of find solutions and give support.
Exactly, and it's kind of hearing however many members, I'm sure there's however many thoughts and ideas, and it's sounds like a place where you can take a little bit from everybody's experience and kind of model something for yourself. And groups are not just for depression, like you're saying. It's sometimes it's good for different diagnosis, care, or being a caregiver. Going through something yourself, or sometimes you think of like new moms groups. They don't call them support groups, but sometimes just gathering
together and share with a shared thing. Like for example, like we are hosting a Savvy Caregiver group with the Council on Aging, actually, and I think it starts
soon,
a couple weeks.
May.
Yeah. And that is a way to kind of have caregivers come together and kind of talk about like stressors and kind of learn some educational things on how to take care of their loved one. And so it's like providing education and the support really does help, especially because, you know, we are social creatures and we, you know, it's very easy to kind of get in our routine and kind of isolate and not be connected as much, but people get a lot of support just being in the space with others.
I mean, I think you mentioned it right there. Like there's all different types and reasonings for groups, and there's different types where sometimes you are just getting spoken to in an educational setting, and then sometimes it's purely supportive where people are feeding off one another. And you mentioned a little bit about we're social creatures, and sometimes we have to make that extra effort to continue to be social creatures, and that's another real focus of the MHOT program, right? You have the therapy and the groups for some different mental illnesses or different diagnoses, but you're also focusing on social isolation in a way, right? And maybe share a little bit about what social isolation is and why it's important that our older folks know about it.
So social isolation can kind of present with people maybe not leaving their homes for a variety of reasons. Sometimes people can't leave their homes because they're bedbound and they're not able to, but other people maybe sometimes they're a little bit nervous to go out and maybe socialize and kind of get that connection. We have noticed there is research showing that people who are socially isolated are at higher risk of depression. And sometimes it also shows that social isolation could be related to dementia or cognitive decline. Like people need to be connected, and sometimes if they're not, it's very easy to kind of fall through the cracks. Maybe something's changing and no one's kind of noticing. But also like social isolation could be a very serious thing. Like it really impacts so much. And so it is important to kind of get that support. And that's why our program really is part of us visiting people in their home is a check, like a social isolation check. We kind of provide that care. We could talk about what's going on, but then we kind of can see people and visit them. So it's like a very supportive thing. And we also, at the agency, I'll put another plug for our agency, we have a volunteer program, and we have a connection with Friendship Works where if someone's feeling socially isolated and they would like a friend, we can connect them with a friend that can kind of like either go to do errands with them, kind of do art, kind of take a walk. It's a way to kind of get people out and connected.
Exactly, because like you said, being alone all the time can have, you know, effects on our mental health, on our physical health, on our overall well-being, but social connectedness means a lot more than just, you know, going outside, right? It's really the connections that you forge between, you know, sometimes a therapist or Friendship Works, or even like we've seen during the pandemic and after, really virtually connecting through people.
Yeah, I feel like after the pandemic, connecting socially felt kind of awkward for a lot of people. I feel like so many people were like just so used to kind of hiding away from others and this fear, and people weren't as connected, and so it's like finding alternatives to kind of Zoom was kind of a big thing during pandemic to kind of connect with other people. I know like people I know, we were like playing board games on Zoom because we were just like, oh my God, I'm going nuts here. Like I need to talk to somebody. I need to connect with somebody. It's like very jarring, and I think some people are still a little bit like worried about leaving their homes because of that. They're compromised and things like that, and so like it might take a little small steps to kind of get there.
Exactly, but sometimes it just does take that one small step to go to one program or to go out to see something. Or like you said, I know Elder Services did a lot of work during the pandemic and following the same with the Council on Aging, but connecting people with laptops or devices and
help people kind of learn different tech devices. One thing we also try to help people learn is MyChart as a way to kind of get connected to your doctor and kind of look at your records, and it's kind of like great to kind of have that extra connection.
Yeah, I think that kind of leads into the third part of your program, which is medical care coordination, which is kind of a mouthful for some people.
Totally.
And what would be that last part of your MHOT program?
So I used to be a social worker in the program, so I'm going to talk a little bit about my experience. So I would work with clients who maybe are having a hard time maintaining all their appointments. They have a lot of appointments. There's a lot of like things to kind of schedule and organize. And so my role would be to kind of help coordinate that, schedule it with them. I would make phone calls with them. I would help coach like questions to ask, give them the questions, and then they would go to the doctor's appointments and kind of work with the doctor. We also have a medical advocate program as well to kind of help somebody if they wanted to volunteer to go with them to their doctor's appointment. But the elder mental health outreach team is really kind of helping coach on how to maintain these appointments, especially like if it's not just medical appointments, it's behavioral health appointments. Maybe they need to talk to a psychiatrist. Maybe they need support getting refills. Like it's kind of helping create the system for people.
Exactly, because sometimes you're going to one doctor here and another doctor here, and you need to see that doctor before another doctor. So it's really helping, it sounds like, to guide them through their experience.
And especially because a lot of times people feel like anxiety going to the doctor. You don't want to hear a bad thing coming up. You don't want another medication added to your like arsenal of medication. You kind of want, it's kind of like a supportive listening, kind of like, hey, have you thought about asking this? Like you mentioned to me like 2 weeks ago that you were feeling a little bit lightheaded. Maybe you should write a question about that down, or like kind of like helping people navigate that system, because you know sometimes it's just good to kind of have that support that we offer.
That's right. That's right. Well, it sounds like a very comprehensive program through the MHOT programs, helping with in-home therapy, helping people navigate the medical system, and helping people with the challenges of social isolation. And that's just one little program tucked into the overall Somerville Cambridge Elder Services. But how would people reach out to you, or if you do take self-referrals or referrals from others?
Yeah, so totally. We take self-referrals. We take referrals from a caregiver. We take referrals from hospitals, from anyone. And what you would do is you would call our community support center, which is our one-stop shop. They provide resources and referrals to older adults. And the number would be 617-628-2601. I'll say that again because I talk very fast. 617-628-2601. And you can kind of talk to a representative over the phone, and they will kind of talk to you about the programs that we offer. And you can self-refer for if you wanted home care, if you wanted a volunteer program, if you wanted our program, the Elder Mental Health Outreach Team program, or if you wanted the Family Caregiver, which is a program that helps people 18 plus who are caring for an older adult, or an older adult who cares for a child or a grandchild. So they can kind of get and we do short-term resources and counseling for that program as well.
That's great. That's wonderful. It really is like exactly what the name says, your access aging point, or your ASAP. So thank you so much for being here today and sharing a little bit about your program.
Oh, thanks.
Thanks.